Good afternoon, everyone. I'm Luke, a Primary Care Engagement Officer with the Northern Queensland Primary Health Network based in Townsville. We'll start with an acknowledgement of country, and the Northern Queensland Primary Health Network acknowledges the Aboriginal and Torres Strait Islander peoples as Australia's First Nation peoples and the traditional custodians of this land. We respect their continued cultural and spiritual connection to country, waters, kin, and community. We also pay our respects to their elders, past, present, and emerging, as the custodians of knowledge and law. So thanks again for giving up your afternoons, and hopefully we'll find a fair bit of information in this afternoon's session. Today, our guest is Peter Rolanidis from Provider Connect Australia Registration's Senior Project Officer. Peter joined the Digital Health Agency in May of 2018. Working in the customer care team, he's played a significant role in increasing pharmacies' registration in the My Health record from 5% to 99%. And Peter has a long history of working in the pharmacy space, having previously built and owned 3 pharmacies in Brisbane. And prior to his career in pharmacy, Peter developed hardware and software systems for a variety of commercial organisations. Thanks for your time this afternoon, Peter.
No problems. So I'm going to go through these slides pretty quickly. It's just like a pointers to remind me what to say, but basically Provider Connect Australia, or PCA as we call it. That's the first slide. There's only about 8 slides here. Then I'm going to get into the live demo. So I know that everybody here is only for about half an hour. So, and I know that this will take about 8 minutes or 5 minutes to get through the slides. And then we'll go through the live demo on registration, and after that, we'll do some playing around with PCA, adding locations and services if we have time. So I'll quickly fly through this. So just so that you know what Provider Connect Australia is, it's an initiative by the Australian Digital Health Agency, known as PCA, and it connects providers with their business partners. Now, you might wonder what is a business partner? Well, we'll cover that shortly, but basically it's for your business information, not your medical information. My Health Record is for medical information. Provider Connect Australia is to publish business information like what practitioners, what services, etc. And I'll show you a nice picture of that shortly. And it streamlines the registration of ongoing updates. So as you have practitioners changing or your services changing, you just change it in Provider Connect Australia, and then we push it out to a variety of business partners that you have chosen. And it enables healthcare providers to maintain a single source of truth. So the whole aim is to have one spot where you put this information in, and then you update it in the one spot when details change, and then we publish it. So the next slide. The main purpose of this slide is it's to support digital health interoperability. So like 6 years ago, 7 years ago, really very few computers talked to each other. So now we're trying to get more and more interoperable computers talking to each other, where medical information can change quickly and easily and securely, as it says there. So healthcare interoperability supports safe, secure, efficient and quality care. It involves an ecosystem of connected providers that conveniently and seamlessly share high quality data and easily understood meaning throughout the healthcare system. It synchronizes validated information across the healthcare system, reducing errors and duplication, and is a single source of truth about healthcare provider services and the practitioners that provide them. And it also establishes unique identifiers for all areas of the healthcare, ensuring these to be reliable, identified, and linked across the healthcare system. So the next slide. Watching time, making sure we don't go too slow. Changes for healthcare providers. Challenges for healthcare. Maintaining service delivery details for healthcare provider organizations with multiple business partners. So these are the type of business partners we've identified at the moment, like health services directories, for example, such as the NHSD or Health Direct. So when you put your information into Provider Connect Australia, we will publish it to the health service directory. We have a few directories already in there, and you can choose which ones you want to publish your information to. Online booking systems, funders such as private health insurers, primary health networks. So all your details are published to the primary health networks in your area. Communication services such as secure messaging services and prescription exchanges, diagnostic services, public and private hospitals, professional associations and peak bodies. Now, Provider Connect Australia hasn't been around that long, so I'll go to the next slide to give you a bit more background on it. But basically, it started in about 2022 during COVID, and it was a pilot to help the Australian public find out where to get COVID vaccines from. So that was its main intention. So, and at that time, people were choosing a brand of the COVID vaccine. So that made it easier for them to say, where can I get my Moderna from or whatever. So now that COVID finished in July 2023, we removed the vaccine clinic finder and we've replaced it with Provider Connect Australia. So mostly at the beginning, we moved all the people who were doing vaccinators, pharmacies, medical centres over to PCA last year. And at the beginning of this year, we're now tackling other healthcare providers and trying to complete the pharmacies, medical centres, as well as allied health. So we're getting more and more people connecting as the time goes by. So that's our main drive in 2024. So the next slide shows how it works. So what happens is you enter your details in Provider Connect Australia. And when I say your details, we'll come up to the type of details shortly, and then so your service details like practice names, service types that you offer, contact details, practitioners who are providing those services. And then we also validate as much information as we can, like HPIIs, and ABNs, and all with either Medicare, AHPRA, or HI service, and ABR. And then we publish them to a bunch of business partners. So you choose which ones you want to publish it to. So if you want your information to go to, say, the NHSD and to Health Direct, then you choose those, and then it'll publish to those so the Australian public can find out what services you provide. Okay, so I wanted to also show this. I've got another slide that I want to pop up momentarily, and hopefully you can see this. Now, can you see this slide, Luke? Did it come up? Yeah, so this slide basically shows the structure of PCA. So when you register your business, your ABN, that's called a participation organisation. So under your ABN, you may just only have one business name, like Tully Medical Centre. So that would be then called the location. And in that location, you offer a variety of healthcare services. You might offer COVID, influenza, and a whole variety of other things. I've had some medical centres do like 29 or 35 services that they do. And if you choose to, you can then say which practitioners are providing those services. And all the information is published on the NHSD. And I could show you this shortly, but I like this slide because of that reason. It's a nice graphical picture. Now I'll go back to my main slides. This is sort of repeating some of the words that we said before. Noting I'm going a bit taking too long. Benefits for healthcare providers, reduces duplication, less forms to complete, and all business partners receive this information, saves time, reduces the amount of follow-up and redirecting messages, information, streamlines the process, which you've sort of said before, improved awareness, complete and update service. So there's only a couple more slides. These are just business partner benefits. So if you want to be a business partner, which you guys are not, you're probably a healthcare provider, so I'm not going to mention too much about it. So business partners can join us and they get a variety of information which they can easily get a list of who, like for example, audiologists, which audiologists are registered in the system. And they can integrate in a variety of ways, but you guys are not going to be business partners, so we don't need to worry about that slide. The main important thing about this last slide is this is the number I want you guys to call, is that number there. After this presentation, I recommend you give that phone number a call, and while you've got your PCA in front of you, you speak to one of our people who are in our office, and they will walk you through the exact steps that I'm going to show you shortly. So that's the main number I want you to pay attention to. And I'm hoping that maybe Luke will grab a copy of this and or send these slides out to you after. But basically we can, like I got one registered yesterday. It only took like maybe 10 minutes max, and it went pretty smoothly through. So I think I'm ready now to jump into the actual live demo. And now, can you see the Provider Connect Australia opening screen? Yep.
All good, Peter.
So I know the screen looks a bit busy, but this is just the intro screen, and this is only my training system. So this is not connected to a live system because I can't put real live ABNs in the live system, which will then upset the real world. So this is only a training system, so I can put any information I want in here. So the more important thing about this opening screen is it's got all the information you need about how to find out more about PCA and how to register. So this registering one is perfect. I've read this a few times and it shows exactly what you need to do. It's probably a little bit too rich in information, but otherwise it's good. So what I'll show you now is noticing we only have 19 minutes left. I'll show you the first step on how to register, and then I'll show you how to do locations and services. So once you click on, say, your organization, the opening screen or the screen, this is the screen you'll see now. Most people, for the first time through, they will not see any organizations down the bottom here. They'll just see pretty much a blank system with just add organization. Now, there are 3 important steps for when you're adding an organization. The first one is, where is my setup helper? Maybe I've got to go add organization. I want to get this. So this is the first step. My setup helper should have popped up, but it doesn't matter. This is the first step where you type in your organization details. Now, obviously your organization detail will be your ABR. So you type in an ABR. I'm just going to grab a random ABR off the ABN lookup, Control C, and you type in the ABN. It'll then check what you are, and it says, okay, this is a business and it's a company. So it knows that, and whatever you do, don't tick that box there, say I'm a sole trader without an ABN. Only if you are a sole trader, which doesn't have an ABN, then tick that. So leave that blank. So you type in all your details here. This is just simple details. You type in your contact details, like your phone number, make that of your business, type your fax number in of your business, type in your email address. Doesn't matter which one we pick. I'm just doing random stuff. And then you type in the address. I'll just go 1 Eagle Street Ride. I recommend you use the automatic address finder, and it does work because the automatic address finder means that the addresses are linked correctly in the system. So then you simply click on add organization. And that was the first step done. You can see we've got a green tick on the add organization. So that step shouldn't take you more than, say, 20 or 30 seconds just to type in your ABN and a few details about the organization. This next step is the one that's slightly harder. This is where it's sign and upload documents. Typically, there are 2 documents you need. You need to have the participation agreement, which can be signed electronically, or you need either a stat deck to say who you are, or if you're not the director, then you can get the office admin person to print it, and then you can get the director can sign it and then upload it. So it's moderately quick and straightforward. So I'll just give you an example of the easiest pathway. So sign and upload documents can sometimes cause some people problems. So it's a lot of information here, but basically you just say, if you're a director, then you say, I'll be signing a participation agreement. And if it's going to be somebody else, then you're best off print it and get them to sign it. So you say what your signing role is, and just answer the questions correctly. Like if you're a director or a secretary or a delegated authority, you just choose whichever one. I'm going to choose, say, director. And then this organization will upload evidence that this person has the authority to enter into this agreement. So I'm going to choose that option first. If I choose the second one, it's going to do a pre-filled stat deck, which is just as easy. So maybe I will choose it to the stat deck option. So I'm going to do stat deck option. I'm going to say I'm the one that's going to be signing it. My address is going to be, I don't know, 1 Eagle Street, doesn't matter, 2 Eagles Court. And you'll see that when I click on save, it will then say save was successful. And now it's brought up these down the bottom here. See that? The participation agreement we can sign electronically, but the stat deck we have to download it, print it, and upload it. So that's the only one you have to do it that way. So I will do the electronic signing because there's a couple of little tricks here. So electronically signing is so quick and easy. It takes you less than 20 seconds. So we'll click on that. It brings up this PDF electronic signing thing. Wait for it to load. And then you don't click on anything here. You just click on the word copy password. So once you click on copy password, you wait for the PDF to be generated. And then in the middle, you'll say you paste your password in here. So you go Control V or whatever you want to do is paste. Paste it in. The screen's drawn. Then you click on start. It zips you to the end. You say click on sign. It puts your name in there. You apply the name, or you can type in your name, and then you say sign. Really, that's it. It says you're all set. So that is the participation agreement signed. So you get rid of that, close it, and we should see underneath it, you can see now the participation agreement is signed. We still have the second document to do, which was the stat deck. So we're going to download the stat deck. And now, obviously, I'm not going to print it. I'm just going to show you an example of what it looks like. I think you'll see it appears up here. So that's the stat deck on the right. You simply print it. This first page is just an example showing you how to do it. So it's really just 2 pages. So you'll see all that details I typed in earlier are pre-filled. So you don't have to do really anything other than get a witness to witness it while you're signing it. And we do have sometimes people say don't answer these questions correctly. Like when it says declared at, that's like it tells you exactly here the place, the day, and the month and the year. So declared at whatever the place is and the day and month. So you really need to answer these questions moderately correctly, otherwise we'll bounce it back, and we'll tell you what the errors are. And that's it. So this tells you the type of people that can sign it. So pretty much a lot of people can sign. It doesn't have to be a JP. So I'll get out of here, and I will now go back to this. I'm not going to proceed with this because then all you do is browse to the file that file you've uploaded, and then you complete it, and then you submit it, and then we check it to make sure that it's correctly signed, and then you get an approved site. So I'll just quickly go back to one that's already approved. So we go to quick navigation. I've got a couple of example ones here I want to show you. Let me just do it this way there. So you can see this is showing you, I'm going to pick, say, for example, Brackenridge Medical Centre. That's just an example one. You can see the head organisation happens to be called the PO, noting that time is running out. And the organisation was created and it was approved. So that's what you would get the first time through. You would just get like a participating organisation and the name of the organisation. None of this is published. The only stuff that's published is underneath it when you have a location. That symbol there, the teardrop symbol is a standard location symbol. So that's saying at this, well, I'm going to choose the Brackenridge one. Brackenridge Medical Centre is the name of the business. That's what's going to be published. And under that, you can see it does two services. It does COVID-19 and influenza. So you can add practitioners, you can add more healthcare services. Like, let's say we wanted to add another healthcare service. So I'm going to add a healthcare service in. And we want to make it, there's a very large list here. These are the common ones at the top. When I say it's a very large list, if you scroll through here, you'll see it's very, very large list of things. So let's say we want to add in, I don't know, aerospace. That sounds like a good one. And when you're adding in a service, there are about 5 key pieces of information you must add in for the service. So you choose the service, then you scroll down. If you want to type in specific details about the service, you can type it in here. Then you say, it says it's active when this particular service, like you might say, we're only going to do COVID vaccines in November. So then you type in your start and end dates for November. But in this case, it's defaulting to say it's active. You can choose languages. You can choose whatever languages you speak in addition to English. You can say we are bulk billing or fees apply or mixed billing. So this service might be free for some and bulk billed for others. And then if you have a booking system, you can use your own booking system, or you can say, yes, we have appointments and it's not just walk-ins. Yes, we do accept new patients and special conditions. You can type special conditions here for this service. Now, the IAR is a new feature we put in a few months ago. It's initial assessment and referral. Now, doctors may know what this is, and so you just choose your IAR level of, I think it's mental health levels, and then it makes it easy to find which doctors support which levels. So if it's not appropriate to you, then you just leave it blank. Okay. Now going down the list, so we're saying this service is going to be run at the same location as the business. So you say use these details. So unless it's not run at this location, then you can change the details. So always check to make sure that the details are correct, and try not to make sure it's private information. Check it, because if you don't put private information in the first place, it shouldn't publish private information. So make sure this is all public information. Type in whatever you like. Check all these details. Again, that was the contact details. And if you want to put a separate postal address in, you can. And you can, if you want to publish availability of the service, to say the service is only operating in the afternoons, then you can type in trading hours if you want of the service, say it's only going to be run in afternoons. Or if you don't want to publish it, meaning it's going to follow the trading hours of the business, then you just say, I don't want to publish the trading hours. Scrolling down, and then the last 2 ticks you have to do is, I want to publish it to the NHSD for both consumers and for other healthcare providers to find you. And you go add healthcare service. And so now when we look at that tree again, you'll see for the Brackenridge Medical Centre, we added aerospace in. So noting that we only have 10 minutes left. So what I want to do is I want to show you now on real live, got to get rid of that box there. Let me say Brackenridge Medical Centre. So we scroll down to say Health Direct. Now, obviously, that was through my training system, so the extra one I added on isn't going to show. But your updates will be updated almost instantly in PCA to Health Direct straight away, and then it gets published to the website within 3 hours of the Okay, so now when you see this, you can see this particular service site has got those two original COVID-19s and influenzas in here. They haven't put any practitioners in here, but you can put practitioners in. All this wheelchair access, all these things come from Provider Connect Australia, the trading hours, all from Provider Connect Australia, and all the address details. And in this particular case, their booking appointments is through HotDoc. Just wanted to show you that. So that was adding a service in. If you have multiple locations, it's all pretty straightforward once you can understand this tree. So let's say you wanted to rename this location that you pre-created ahead of time. You say, okay, I wanted to change it. You want to edit the details. We want it to be Brackenridge Medical Complex. And you just change it. You can check all the details of that particular location. If there's more facilities you want to add, you edit these at, we say it's also got free parking. And if you have an address update, you just update it. And then you go save. So now when we go back to that tree again, you will see it will say Brackenridge Medical Complex. Okay, and you can add other services in. You can see there are 3 services, or you can remove services. And you can add practitioners in, like for example, let's go into influenza. We say we're only going to get certain doctors doing that. So we go practitioners, and you say there's no written practitioners here. So we want to add a practitioner in. You simply type in their ARPA number, and I don't have any ARPA numbers as an example, and you find them. It shows you a list of what it thinks you found, and then you say add it. I'm not going to show you any of those for now. So I think we can probably open it up now. Have I missed anything or are any questions?
If you're not feeling brave, feel free to type your question out in the chat as well.
So what I recommend people do is they just get onto Provider Connect Australia. You access it through Proda. Now, while I've still got the helm, I'll quickly show you my live Proda. This is my real life Proda, not the training system, just to show you that you access it. Wait for my 2-step verification to come through. And where you can access PCA from, because people go, well, I don't know where to find it. So wait for my 2-step verification to come through while we're waiting for any questions. Let me just see if there's any questions. There's no questions because I don't have the question list up. So waiting for the 2-step verification.
Cool. So Charmaine has asked, so we need to complete both the participation agreement and the stat deck.
Look, if you're a sole trader and or you are a director that's visible, that the standing officer, whatever word is, then once you do the stat deck and it matches your Proda name, it won't ask for any additional evidence. But I've like half of them go through without the stat deck. But if you want to do the easy pathway, just print the stat deck, upload it, and then it'll be done. But you're right. So if you're a company or a trading trust where the director's name is hidden and we can't find a match, well, then we'll ask you to do the stat deck. So I've got my 2-step verification. But the stat deck, it's all pre-filled for you. All you got to do is press the print button, get the director to sign it, and then you upload it. I know it's an extra step. And if you call our number, we will help you walk through it all easily so you don't go on the wrong path. So hopefully this goes straight to my Proda. Yes. So this is my Proda. So where to find PCA is Proda is really just a portal to do ID verification because you've done the 100-point verification to get a Proda, so it knows who you are. So Provider Connect Australia, this is alphabetical, is right down the bottom here. So that's how you get to the real live Provider Connect Australia. So this is actually like the live system at the moment. So I made up a fake business here, but that's actually now in the live system. So I probably need to, that was just an example. So I'm not going to go any further on this because that's live. In fact, I'll just blast it away. Poof. So that's how you get to, now we're back in the training environment. So I know this looks a bit busy with all these extra words down the bottom here, but basically for one business, you'll have the ABN name, whatever the ABN name is, it could be anything you like. And then under it, you'll have, if you do the retrieving the HPII from HI services, then you'll have the HI name, which is your Medicare name, which isn't published. It's only from the location that's published. Yes, got a question? Oh, somebody's just joined.
Yeah.
Okay, so I think I'm happy with everything like that. So I recommend you call our number because we have like a few people who are doing PCR registrations daily, and call them, and it's easier for you to call them and they'll walk you through it. And even if we'll do a screen share for you if we're not sure where you're up to. But basically, our people are pretty good, and we can walk you through all the slightly tricky steps of registration. Registration is the first part. Adding locations of services is the second part. So just getting through the registration part. So participation agreement is super easy. The stat deck and or the looking up the ASIC information might be slightly harder because you have to do an upload and download. Okay. I think my timing went pretty good. I was consciously speaking quite fast because everybody can listen to it in a recording later.
No, I think it's all spot on. So yeah, if you did sort of join halfway through, don't worry. We have recorded this and we will be sending it out once it's all sort of tidied up and whatnot. Actually, Peter, do you want to maybe go back to your presentation and just pop up that slide with the number in it, and I can type that into the chat as well so that it's there for anyone.
That number there, where my arrow is pointing. Oh, no, that one there. Okay. I know it says a Canberra number, but we have a person, 2 people in Canberra, 1 in Sydney, and 3 or 4 in Brisbane, and we're all ready to help you out with PCA to make it moderately seamless, so you don't have any problems.
Well, if there are no more questions, I think we might leave it there. Everyone can get back to their day. Thank you so much for coming along, and thank you, Peter, for your time this afternoon.
No problems. Please call us, and we'll help you with the registration.